Welcome back. Navigating the healthcare system can sometimes be a challenge, but you might be surprised to know about all the programs that are in place to help. In this week's Medical Center Health Systems Taking Care of You, we're talking about a how-to approach to healthcare. Our guest today is Diana Ruiz. She is the Director of Community Health at MCH. And this is a really interesting topic because the hospital is making a concerted effort to follow people through and help them with those little questions that might end up getting them back into the hospital, correct?
Absolutely. So this is the first type of program that we've really done like this. So we're kind of breaking ground here. But last year we started this transitional care program in which we follow patients, as you mentioned, from the inpatient side to the outpatient side. So we're really focused on promoting health and wellness, really empowering patients to take control of their own health, with our help, of course, in order to prevent those preventable readmissions, those oops, I have to go back to the hospital.
Because I suspect you might be surprised at the little things that keep people from continuing with the health care that they need. So who qualifies for this? How do you determine the kind of people who you sort of help to navigate through?
Well, ideally, we'd love to help navigate everyone, right? Because it is a complex healthcare system, and as we continue to grow, we have even more entrances and exits out of our system.
Right.
But right now, we're primarily focused on patients that are high risk for readmissions. And what that means is maybe familiar faces, people that keep coming back into the system or back into the emergency room for those little things like they didn't fill their prescriptions, or they didn't know which medications to take. They didn't know which doctor or when to follow up with that particular doctor. So we really focus on those high-risk patients that we worry about, that maybe lack the social support, economic support at home to be able to manage their care.
They can expect some phone calls. What does it feel like when the navigator is helping you through the process?
So we typically meet patients before discharge. So we have two parts to this transitional care program. We have these wonderful transition nurses on the inpatient side, and they help guide patients to prepare for discharge, to leave safely. And then the baton is kind of passed off, and we as community nurse navigators in my department take the patient from there. And so patients should expect maybe a visit inside the hospital explaining who we are and why we're following them. And then afterwards, there's no question, they know what to expect. We make routine phone calls, typically at certain days after discharge, and truth be told, we form relationships with our patients. Some of them that are watching might recognize, oh yes, I've been one of those patients. So we call them, we help advocate for them, we call their doctors if needed, we help them obtain lower cost medications. Sometimes we even go to their homes if needed. It's not so much a home health service at all, actually, but rather just a home visit to say, do you need help filling out this application? What else can we help with? What can we help, maybe partner, what community resource do you need?
And that's such a, that's a treasure chest of someone who's just, so we know you may have some more questions, and that's why next week Diana is going to be back with us. We're going to talk about some specifics. What specifically can the program bring for you? I love this. I think it makes a lot of sense. Appreciate the hospital for doing it. Thank you for being here with us today.